Healthcare, I would say human resources and, organizational health is certainly much more difficult today than it used to be. It used to be you had a health choice, that was it. Today it's much more complicated. We've tried to educate staff to say, look, healthcare is going up. It is within your control. It's not something that's going to be a given. We've got to work together to keep our costs down.
The total bill for us on healthcare right now is about $11 million. Now that's both the employee's share and the company's share. One of the things my personnel manager likes to remind me of is he says, Gary, I got to spend $11 million. All we're talking about is how do we whack up the pie. That number has gone up. As we have been in a self-insured plan for a lot of years, we have really conveyed to employees, and they've done a phenomenal job of recognizing that they control that cost. And for the most part, my coworkers have figured out that the better job they do of that, the better job we control the premiums going forward. I've gotten actual stories from people that when they see how much a prescription costs or a procedure costs, they go back and they start asking questions. One of the traps that we have had in healthcare in this country is nobody knows what anything costs, and they never had an incentive to care. If you take your car into the garage and they say, oh, well, you need new tie rods, you don't just say, oh, go ahead. You ask how much it's going to cost. We don't tend to do that as consumers. That's why getting some form of a meaningful deductible, a meaningful copay does make sense.
The second thing I'd say is don't be afraid to try different things. Several years ago, we started boot camps here. So after work on Tuesdays and Thursdays, we run boot camps. So we have cardio boot camps and we have body toning boot camps. And I'm proud to tell you that I was one of the first people to sign up because I wanted to show that you don't have to be, a physical fitness, master to seek health and wellness, and that anybody can do it. So I made a commitment that maybe, at 61 years old, if I showed people that I was willing to do it, and our classes are full, there's waiting lists to get into them. We try to make it fun. We also have a cafe that has a salad bar every day, as well as healthy food options, so that you're not just eating fast food. And 2 years ago, we had a program to get everybody associated with a primary care physician, and we're thrilled to say today that we have 90% of our staff with a primary care, and we've reduced visits to the emergency room and urgent care in half of what they used to be, and that's helped to keep our dollars down. Part of it is that our staff didn't know that it cost, $250 to walk into an emergency room. Urgent care is $85, primary care is $50. So, we educated them, they listened, and they cooperated because they appreciate their benefits too.